This week we had hopeful news on the COVID vaccine front. Researchers say one leading contender showed a good immune response.
But once a vaccine is manufactured, it has to be distributed. So who gets the vaccine first? Good question. Heather Brown explains who decides and who might have to wait.
We are so craving good, positive news.
The science is hopeful.
A vaccine later this year is not impossible. A lot of things will have to go right.
I think we're all cautiously optimistic to be able to say that. It's what happens after that I think we need to get our expectations correct around.
Patsy Stinchfield is with Children's Minnesota.
Once we roll it out, it'll be in tiers.
So even as the manufacturers make millions of doses,
a major dose of funding from the government,
at the same time researchers study it.
We did this with H1N1 vaccine. We'll have initially very few numbers of vaccines, and we'll have to decide who gets it first.
A CDC committee makes that decision.
Those are very public meetings.
Stinchfield is one of the committee's liaison representatives.
You decide based on risk. So that'll be healthcare workers who are on the front lines taking care of people with COVID. You have to have healthy people to take care of sick people.
After that, it's high-risk groups, perhaps older people or people with pre-existing conditions.
We are very concerned about the disproportionate impact on people of color.
None of this has been decided yet.
There are certain people that should expect that they will need to wait. So, and it might even be pediatric patients.
Because kids are less likely to get sick.
To have us be able to vaccinate all of the United States, it will take us several months to do that, and maybe even most of next year.
It's not clear yet if the vaccine will come to the states or go directly to providers. But in 2009, at Children's, during H1N1,
we got 1,000 doses for our patients. And we sat in a room and we debated this.
They're planning on that again.
I hope we don't have to do that, but I'd rather be prepared.
This seems a lot more complicated than just, hey, we're going to have a vaccine by the end of the year.
It absolutely is. There's a lot of things that can go wrong, but the other thing to be encouraged about is there's a lot of us who do this regularly, and we are working hard on thinking through all of those elements.
Heather Brown.
We'll be ready.
WCCO 4 News.
Stinchfield says that it is important to note that enough people need to actually take the vaccine for herd immunity. That would require more than 50%, but 60 to 80% would be better.
In the 2018-19 flu season, 53% of Minnesotans were vaccinated for influenza.